Welcome to Telesur. I'm Carla Gonzalez in Quito, and this is from the south. Venezuela has announced that almost 50% of confirmed COVID-19 patients have recovered. Communications Minister Jorge Rodriguez said authorities reported only 4 new cases in the last 24 hours. Meanwhile, 84 people out of the country's 171 confirmed cases have been discharged from the hospitals after testing negative for the virus and showing no symptoms.
Almost 50% of all infected people has already recovered. And when we say recovered, it is not like in other countries such as Colombia, where they count them recovered even if they tell people to remain in their houses. 85% of the confirmed cases stay in their homes, and that increases infections inside families. These are the cases that are present in Colombia. Venezuela cares for its patients as we provide free medicine, and as I've said earlier, almost half all confirmed cases have already recovered.
Rodriguez also warned about the risk of imported cases due to the fast spread of the virus in Colombia.
At the moment, Colombia is considered to be the main source of infections for Venezuelans, due to the arrival of people from Colombia. We have established a control point in the locality of Ureña, and we are going to be much more cautious, much more strict and careful to find illegal crossings. We have seen a decrease in the transit of travelers from Europe, but in the case of Colombia, it was accelerated by the simple fact that this epidemic is not controlled over there in any ways. There is no proper record of cases, and that poses a risk for the strict control we are doing here in Venezuela.
Brazil's health minister has said the government plans to hold talks with drug gangs and militia groups in favelas on how to contain the COVID-19 pandemic.
In the favelas, we have to understand that these are areas that the state is often absent from, where drug trade and militia rule. How do we build this bridge in the name of life and health? Yes, dialogue with drug trade, with the militia, because they are also human beings and they also need to collaborate, help, participate.
Staying in Brazil, the country has recorded 133 deaths from the new coronavirus in the last 24 hours, making it the deadliest day yet in the country's fight against the COVID-19 pandemic. Our correspondent Brian Meir has the latest.
Last night, the government announced that 133 people had died in the previous 24 hours due to the coronavirus. This is the highest death count to date in Brazil. Now, a lot of journalists and public health specialists have been saying all along that the official numbers are much lower than the actual infection rate because of lack of testing. In fact, Health Minister Luis Mandetta has admitted this. So as they're ordering more and more tests from China, as they're beginning to roll out more and more tests, journalists and health authorities are coming up with different ways to estimate the real number of infections. And one of the ways of doing that is by comparing hospitalizations for pneumonia during the month of March with those of March 2019, and the results of this show that those hospitalizations were 4.5 times higher last month than normal. Last night, President Jair Bolsonaro gave another speech extolling the virtues of chloroquine, which has not been properly tested in Brazil yet. And he announced that it's rolling out into the health system, they're producing massive amounts, they're purchasing it from abroad, and that people should go back to work, and if they get sick, they've got this medicine that can just cure it, he says. Luckily, the state governors are still just ignoring him when he says these kind of things.
That was Brian Meir from Brazil. Now to Ecuador. The city of Guayaquil is the hardest hit by the COVID-19 with more than 2,300 cases. The mayor, Cynthia Viteri, who had previously claimed to have the disease, said on Thursday that she recovered and then left her house to visit a local hospital. She says she expects tens of thousands to die in the city in the coming months.
This hospital, thank God, hasn't been infected, and doctors here are making sure it stays that way. So my intention is to bring new equipment here, so pregnant women can come here, because they can't go to other hospitals, because they would be risking their lives, and the lives of the elderly, who are dying one by one. If you watch the news, they are dying every day. This is a silent war. We see them die, but we don't hear gunshots.
Our correspondent Denise Herrera in Quito has more about the situation in Ecuador.
The Ecuadorian authorities have informed that Ecuador has 4,965 cases of this new coronavirus and 275 deaths. The government also announced new preventive measures to stop with the spread of this new COVID-19. They said that they will evaluate the restrictions of mobility in each province of the country. In this context are still the citizens from Guayaquil denouncing that they didn't receive any government help, and now the citizens from Montesinain are against the project of the new cemetery announced by the mayor of Guayaquil, Cynthia Viteri. In this context, the citizens are denouncing that this project will affect them, will affect their territories, and they are still announcing that they didn't receive any help, any water, or any food. They are asking the authority to help them and to respect the territory. Also, the medical sector in Ecuador is affected by this new coronavirus. We should remember that doctors and nurses were denounced that they didn't receive any government help, that they didn't receive any medical support to face the sanitary crisis in the country. Meanwhile, the government said that they are receiving help from different sectors, from different countries, and for different international organizations, so they are taking all the actions and taking all the preventive measures to protect the citizens and the professionals.
That was Denise Herrera. And we'll take a short break now, but join us again in a minute.
为了保持身体健康，我冥想。
Para mantenerme saludable, yo corro.
To keep myself healthy, I study.
Για να διατηρηθώ υγιής, τρέφομαι σωστά.
Para mantenerme saludable, yo bailo.
Para mantenerme saludable, yo purifico mi espíritu a través del cuerpo. ¿Y tú?
Guide your body. Tuesdays, only on Telesur.
Thank you for joining us again. The Cayman Islands is now the 5th country in the world and 2nd in the Caribbean to report medical equipment being seized by the United States amid the COVID-19 pandemic. Barbados, Canada, Germany, and France have all had the same complaint.
The U.S. authorities actually removed from a vessel, a ship that was coming to Cayman, a container which contained 8 ventilators and 50,000 masks and various other bits and pieces which I don't have the details of. And so that has been a huge disappointment to us. All of those were things that were produced and purchased in the United States.
Jamaica's Prime Minister Andrew Holness has extended the nation's COVID-19 restrictions for the Easter holiday. The country's stay-at-home measures were expected to end on April 7th.
The Easter weekend, the curfew will be from Friday the 10th of April 2020 through Monday the 13th of April 2020. The curfew will commence at 3 p.m. in the afternoon and end at 7 a.m. the next morning. In other words, the non-curfew hours, that is the period of time that you will be able to move about freely and conduct the essentials of life, would be from 7 a.m. to 3 p.m. daily over the Easter weekend.
In Cuba, free medical health care for all citizens has always been one of the pillars of the revolution. So let's have a look at how this system is handling the COVID-19 pandemic.
In these days, marked by the novel coronavirus, these images are exclusive to Cuba.
Good morning. We are medical students and we are doing a survey on the health of the population to see if they have symptoms.
Over 25,000 medical students visit Cuban homes to detect and prevent new cases of the pandemic.
People are grateful, not just because they are being cared for, but because they are being reassured that things are under control.
The ongoing search for possible infections is part of the island's healthcare system.
Have you had any respiratory symptom? Anyone from your household?
It has over 100,000 doctors as well as 9 specialists for every 1,000 residents. Since 1984, the development of a family care program has been an essential part of the system as well, providing one doctor to every community.
This framework is Cuba's greatest strength, something that was developed over many years and that has been improved over time with better training and resources. This allows thousands of med school students to make home visits.
Despite foreign pressure and shortages caused by the decades-old U.S. blockade, the island has guaranteed free healthcare to the entire population, while also helping other nations across the globe.
Over 50 years we have been providing help. Since 1963, over 450,000 health professionals across various generations have saved over 7 million lives.
Biotechnology is one of the best developed fields in Cuba, with close to 20,000 workers moving forward with many advancements, including the interferon alpha-2b, which has proven to be essential in the global fight against the novel coronavirus.
The Cuban interferon has been worked on for over 30 years. There is a lot of experience working with it for other illnesses. We know it helps patients build an immunity, and we believe it will continue to be essential to fight the coronavirus.
Doctors, not bombs. That is the message Cuba has long defended, and that has led to over 600 Cuban doctors to be deployed to more than 14 countries affected by the pandemic.
We are an army of white ones, willing to share our knowledge and save lives anywhere in the world.
Amidst a smear campaign aimed at the island humanitarian program and a global pandemic that has put on display the fragility of developed nations' health system, Cuba is strengthening its system with solidarity and a guarantee of life over money.
South Sudan has confirmed 3 cases of the novel coronavirus. The patients were identified in the cities of Juba and Torit and recently returned from COVID-19 infected countries.
A total of 65 contacts have been listed. The Ministry of Health rapid response teams have collected 50 samples from the contacts of the 3 cases for testing. They are now tracing more contacts of all the confirmed cases.
South African President Cyril Ramaphosa has announced an extension of the lockdown period until the end of April. As of Thursday, the number of COVID-19 cases stands at 1,934 and the deaths at 18.
This is the Elsies River Community Clinic. It's servicing an impoverished working-class community just outside Cape Town. It's also a community with a high prevalence for HIV and TB. Since Monday, government started rolling out a mass screening and testing program.
This week we have started that mass community testing and screening, and we'll know in terms of the impact probably by, most of the results across the provinces by next week. But that will influence whether the lockdown should continue or not.
Around 10,000 field workers will be visiting homes in villages, towns and cities to screen residents for COVID-19 symptoms. This is a screening and a test center set up for members of the public. And your first stop is right here, where you have to fill in a questionnaire. And here they put 5 questions to you. And if you answer yes to any of those questions, you'll then be sent to this van for a proper test. With 495 infected, the Western Cape is the province with the second highest number of COVID-19 cases. So far, 4,000 have been screened in this province and 250 tested. Meanwhile, everyone is waiting to hear from the president whether the lockdown will be extended.
We will be able to make a proper, if you like, scientific assessment in a few days' time to see how well this lockdown is serving the people of our country. But what I can say, if we had not locked down South Africa as we have, I can tell you without any shadow of doubt that the infection rate in South Africa would have been a lot higher than what we have.
With testing still limited, the apparent rate of increase in infections in South Africa has remained relatively low, but health experts warned against the premature suspension of the lockdown.
With my colleagues from the Brazil, Russia, India, China and South Africa, we are in it in order to make it a point that we fight it.
The national lockdown is due to expire on the 16th of April, but many countries have opted for an extended lockdown period. Johan Abrams for Telesur in Cape Town, South Africa.
Saudi Arabia has announced a ceasefire in Yemen starting on Thursday. The UN called for a halt in hostilities amid concerns of the COVID-19 pandemic. This could pave the way for the first direct peace talks between the Saudi-led coalition and the Houthi rebels, who have been at war for more than 5 years. The ceasefire will reportedly last 2 weeks and could be extended for all parties to discuss proposals, steps and mechanisms for a sustainable ceasefire in Yemen.
We find collisions, inconsistencies, and differences in the concept and details of this ceasefire initiative. One party says that it must be a comprehensive initiative and it won't be accepted by anyone. And another party says it is the limited initiative that is limited to 2 weeks as an urgent measure against coronavirus. So the scene is foggy, just as we are used to seeing from the UN and its envoy to Yemen.
Our position is clear and fair. We call for an end to the war, completely and permanently, and a lift on the blockade. What Saudi Arabia announced is not an announcement of a truce, it is an announcement of a continuation of war, because it uses its military, air and naval forces to impose the blockade. The harm inflicted by the blockade on the Yemeni people is bigger than the harm of the war itself.
We have more stories coming up. Don't go away.
Who's moving the chessmen? What interests motivate the actors behind each event? The board is deployed there. Critical move. Investigates every event from Monday to Friday. Only on Telesur.
Welcome back. Let's continue with news. UK Prime Minister Boris Johnson has left intensive care after 3 days of treatment for COVID-19. Johnson had been in intensive care since Monday after his symptoms for coronavirus worsened. He tested positive for the virus 2 weeks ago, and at first he had only mild symptoms. Meanwhile, Foreign Secretary Dominic Raab, who is standing in for Johnson, warned that the lockdown, which was set to end on Monday, was not likely to be lifted since the number of cases and deaths continue to rise. As of Thursday, the government reported over 65,800 cases and almost 8,000 deaths. Despite the COVID-19 pandemic, Germany has decided to allow the entry of tens of thousands of seasonal workers from Eastern Europe in the months of April and May. 2 planes carrying Eastern European farm workers, mostly from Romania, Bulgaria, Ukraine and Hungary, already touched down in Berlin and Düsseldorf, amid strict precautions to protect the country from the new coronavirus. Workers need to fly into the country in control groups and are subject to medical checks upon arrival. They then have to live and work separately from other farmhands for 2 weeks and wear protective gear.
Before entering the country, there will be a health check, and this will be sent to the responsible health office. There will be no individual trips when you arrive here, and every company must grant a certain distance to be kept during transport and when people work together in groups. That is for the first 14 days quasi-quarantine, during which they can work.
Over 12,000 people have died in France due to the COVID-19. The Director General of Health says the figure is spiking as more healthcare institutions are providing their data.
In the past 24 hours, 424 deaths have been registered in hospitals. We have recorded 4,166 deaths in nursing homes and medical social institutions since the beginning of the epidemic. As I explained before, more and more establishments are sending us their data every day, which explains the increase in this figure. As you know, we had a technical incident at the National Public Health Agency yesterday. Therefore, the period covered is not 24 hours, but 48 hours. Since March 1st, if we add up the deaths in hospitals and health establishments, we have registered 12,210 deaths in France as a result of the epidemic.
Italy's death toll as a result of the COVID-19 has risen by 610. However, more than 28,000 people have recovered from the virus.
Today, unfortunately, there are 600 new deaths, while the total number of recovered patients stands at 28,470, which is 1,979 more than yesterday. 96,877 people are currently positive, with an increase of 1,615 more than yesterday. Of these, 3,605 are in intensive care. The decrease in the number of patients in intensive care and in treatment and hospitalization wards still needs to be underlined. The number of patients in the intensive care unit decreased today, compared to yesterday, by 88.
After over 2 months in quarantine, the Chinese government lifted the lockdown on April 8th on the city of Wuhan, where the novel coronavirus first emerged last December.
This is what Wuhan looked like a mere 2 months ago. And this is what Wuhan looks like now. The original epicenter of the COVID-19 pandemic, the city of 11 million is slowly living up after enforcing a strict quarantine to stop the virus.
Greetings from Wuhan. Today is day 76 of the quarantine, and most restrictions have been lifted. But there are still controls in place to protect the population. The city looks colorful, full of life, with joy. People are full of optimism.
Latin American and Caribbean youth who were there when the worst of the pandemic hit Wuhan were finally able to leave their homes.
During the quarantine, I stayed at home for around 65 days. On day 66, we found out that the community where we live was free of the pandemic. On April 5th, we received a certificate of health, which allows us access to certain places. That was an exciting day. At first, I was nervous, because you don't know if they took the right decision, but the feeling of freedom is extraordinary.
I miss the dynamics of the city, the movement, walking amongst other people. This is a safe city. You can enjoy your time here. You can see the Yangtze River, enjoy a cup of coffee. I miss all of that, but I think we will slowly recover it.
To exit Wuhan and to move around the city, everyone needs to present a green QR code that verifies their health. A mobile app was developed by the government that certifies that people are in perfect health.
When they want to exit the city, citizens need to show this code to prove they are in good health. If that is the case, their code is green. This app doesn't work for us foreigners at the moment, so we need to show a certificate of health.
The lockdown and the strict measures imposed by the Chinese government left vital lessons for the globe. Lessons that need to be heeded now that the pandemic is ravaging the American continent and Europe.
Reading helped me get through this time. Studying and occupational therapy as well. This was a fruitful time for my mental health. I was at the epicenter of all this, and I did not know what was going to happen. Nobody knew. Thankfully, I never feel ill, and I knew that if I followed the measures, I would get through the situation. This way of thinking helped a lot.
Our experience was intense, but it was also frustrating. We needed to learn many things, and now we need to transmit that knowledge to our nations, so they may follow the same road China paved to stop the virus.
Wuhan will be scarred by the experience for generations to come, and life in the city will never be the same as before. COVID-19 hit Wuhan particularly hard as the majority of China's 3,300 deaths happened there. But still, the city is rising back, showing the world that there is a light at the end of the dark tunnel.
Indeed, there is a light at the end of the dark tunnel. There's hope for humanity. And with that, we end our news brief. But you can find these and more stories by checking our website, telesurenglish.net. And be sure to find us on social media. We're on Facebook, Twitter, and Instagram. For Telesur English, I'm Carla Gonzalez. Thank you for watching.